The Heart Center encompasses 3 centers of excellence, the first being the cardiovascular surgery aspect, the second being our electrophysiology group, and then the interventional cardiology group are the mainstays. Those are our 3 pillars. Outside of those 3 pillars, we also have a chest pain center. That is a big part of what we do in the Heart Center.
This is a complete package. We offer everything from our basic services such as heart catheterization and stenting in patients who have blockages in their heart, but we expand this to another level. We have all the new technology to offer patients needing minimally invasive procedures on their valves, patients needing procedures to improve their quality of life because they may be suffering from an arrhythmia.
We are very fortunate at Lakeland Regional Health to have a very experienced and very skilled set of physicians, nurses, and technicians to allow us to provide very high quality care.
What's unique about our center is that we will emphasize a team approach. Your surgeon is quite important in the overall outcome and decision process, but also the ICUs, the floors, the rehabilitation, your ability to be able to go home and have a meaningful recovery in the long term is quite important. We're actually trying to assess what the specific goals are that need to be met for an individual, and then collaborate with, it may be an interventional cardiologist, an electrophysiologist, a cardiac surgeon, so that we can provide the best approach to reach that goal, which in this case would be faster recovery, less invasiveness, and sooner back to your normal life.
We've always been on the cutting edge. We started doing interventional cardiology back in the early 80s. We've always been first with all of these major cardiovascular advances, and that really sets us apart today. We were the 3rd hospital in Florida to start implanting the Watchman Device, and this is because they need pristine numbers, so they go to the most experienced labs in the country.
The Watchman Device is a device that was designed to aid patients who have atrial fibrillation. Atrial fibrillation is an irregular heart rhythm that unfortunately is associated with a very high risk of stroke in certain patients. So the idea behind this device is to take a patient who is at high risk for stroke but can't take anticoagulation and markedly decrease that risk of stroke and avoid the anticoagulation by placing this device in the left atrial appendage.
As an institution, we decided we wanted to be the best at what we do. Lakeland Regional Health is amongst the first in the state of Florida to be an accredited PCI designated chest pain center. To be an accredited chest pain center requires a major commitment of the institution, resources, personnel. When a patient has an acute heart attack, the goal is to open up the clogged up artery as quickly as possible. That decision was oftentimes made when the patient arrived in the hospital. We decided if we can train the paramedics to interpret the electrocardiogram in the field prior to hospital arrival and notify the hospital, we can begin to get hospital resources ready and prepared to receive that patient. And we have found through a very aggressive training that the paramedics read the electrocardiogram as good as physicians. With this partnership with EMS, that we shave on average 15 to 20 minutes as far as restoring an occluded artery in a patient with a heart attack. This has translated into important benefits for our patients.
From the time we got to the hospital to the time that I was in the Cath Lab was probably 15 minutes or less. It was that fast. The care in the Cath Lab, the people were absolutely amazing. They were well equipped to take care of an emergency situation, which is what it was. I really feel that I am still here today because of the technology that Lakeland Regional Health has. Their staff just trained to know what to do just at the right time, the right people in the right place at the right time.
A hybrid catheterization lab is different in the sense that it can immediately convert into an open operating room. So many procedures that we now do are in conjunction with the surgeons, and often we try a minimally invasive approach first. But in the event of something changing during the procedure, we can immediately convert to an open approach, and the surgeons are available to immediately change that approach, and the room has all the facilities to do that. Procedures done typically in the hybrid catheterization lab would be a transfemoral femoral aortic valve replacement. These are now increasingly common and done usually in high-risk patients who need a valve replacement cannot have open procedures. This is ideally done in conjunction with a heart surgeon and an interventional cardiologist. We would also take care of aneurysms in the belly in a hybrid lab where, again, 2 physicians are usually involved in that procedure.
The Heart Rhythm Center at Lakeland Regional Health does use a variety of very sophisticated heart rhythm devices, which range from simple pacemakers to defibrillators to devices which resynchronize the heart and provide cardiac resynchronization therapy. Ablation is a technique by which electrophysiologists identify the sources of abnormal electrical impulses in the heart and then correct those electrical impulses by selectively destroying the tissue that's responsible for them.
The Lakeland Regional Health Heart Center tries our best to manage patients in a cohesive and stepwise fashion. And our approach is to assess the patient as a whole and try to figure out how can we manage this issue non-invasively. From an arrhythmia standpoint as well as a coronary artery disease standpoint, our goal is to get you back to functioning at your baseline status without the use of invasive procedures, and to do it medically as well as with diet and lifestyle modifications. Lakeland Regional Health is one of the most wired institutions in the country, not just from a technology and computer standpoint, but we offer our patients the most sophisticated pacemakers and defibrillators that exist. Lakeland Regional's mission is to improve lives by providing exceptional health care, and I think that's very evident in the technology we offer our patients.
The Heart Center really is a collaborative effort of some of the best professionals in the field, accumulated here in one institution where a hospital is committed to delivering the best care and the highest quality